Hi everyone! In this video I wanted to continue the discussion I started in my previous videos where I talked about the influence the current economic system has on the quality and availability of healthcare. My channel is about mental health, so I will mainly talk about psychiatric care system, but overall I feel like the other areas of the healthcare system are not that different. So when I was doing my research of my video about ECT, I came across some comments like, I wish I could do ECT, but I can't afford it. Those comments were from US citizens, obviously. And I was thinking, is this for real? So a person is in so much pain that he wants to do ECT. And he can't afford it, probably because his illness impaired his ability to work, and the government of one of the richest countries in the world just says, I don't care, you're on your own. Without getting the medical help, the person with the serious mental illness is very likely to become homeless. In fact, according to 2015 assessment by the US Department of Housing and Urban Development, 45% of homeless people have mental illness. This normalization of leaving sick people one-on-one with their illness seems completely immoral to me, and it is definitely not a Christian thing to do. It has always been puzzling to me how people manage to combine Christian morality with the support of unregulated capitalism and lack of social safety net. It seems like these views contradict each other. In a single-payer system, no one has to become homeless because of mental health problems. Other than the cruelty of the private insurance system, there's a couple of other major issues I have with it. The first one I want to discuss today is freedom. A lot of people associate personal freedom with lack of regulation and nationalization of industries by the government. And there is some truth to that, but in some cases it's exactly the opposite. The number of entrepreneurs per capita in the countries with single-payer healthcare system is much higher compared to the countries with private insurance healthcare. This is not an opinion, it's a fact. The person is much more free when he doesn't have to worry about the basic things that are needed for survival. When he can leave the job he doesn't like and pursue something else without putting his health at risk. Statistically speaking, the happiest people live in Scandinavian countries, where they don't have to be enslaved by their healthcare insurance and student loan debt. So the other thing that I really dislike about private insurance healthcare is that it's way more expensive. The consumer not only has to pay for the medical service, but also for all this giant bureaucracy that no one really needs. A much bigger number of non-medical employees is involved in serving the consumers. So overall, I'm glad that I live in a country with nationalized healthcare. However, there are certain things that can be done better. I want to briefly describe how it works. If the patient is treated on an outpatient basis, then the doctor's visits are free, but the medications are not. In case of hospitalization, everything is free. The food, the medication, tox therapy, ECT and TMS if needed. If the patient doesn't get better, then consultations of experts in their field can be provided. The patient can stay there as long as he needs until the doctor decides that he has improved enough to be ready to work and continue the treatment on the outpatient basis. And when the person is out of the hospital, he works, he pays taxes that fund the healthcare system, he buys his own meds, but the visits to psychiatrists are still free. So that's how it works where I live. And generally speaking, putting aside some minor things, I'm happy with how it's organized. No one has to lose everything and become homeless because of mental health problems, and I'm very, very happy about that. No one has to stress out about how many days of inpatient treatment your insurance covers. You can stay in the hospital until you actually get better. The only major thing that I don't like is the salaries of the doctors. I don't think it's fair that the doctor makes less money than most people, and I don't think that it is good for society overall. I would gladly pay more taxes to make sure that the doctors get paid what they deserve and that I have a solid medical safety net under me. By the way, I've also been to doctors who work in the private system, and I didn't notice any difference. The surroundings were prettier, the bills were high, but the treatment was exactly the same. The reason why the doctors weren't able to help me had nothing to do with whether the treatment facility was private or public. It had everything to do with how much power the pharma companies have. They influence the doctor's education, both initial and continued. They influence the research. They influence people who create official treatment protocols. They influence the doctor's prescription habits by advertisements and gifts. And most of the time, they don't have to disclose their interactions with anybody. All of that created the over-medicalization in psychiatry we have today. Various treatment options just don't have equal opportunity to be prescribed to patients. The doctors just prescribe man-made, patented pills to me over and over and over again. They never said a word about natural treatments that are scientifically proven to be effective and safe. And it's not because they're bad people, it's because they were taught that way. I have a detailed video on my channel about the undue influence of big pharma, and I encourage you to see it if you haven't already. The link will be in the description. And overall, I think that our health should not be a commodity. It just doesn't work very well. I'm not against capitalism altogether. There's good and bad things about it. There's also good and bad things about socialism. I wish people could stop fighting their ideological wars and realize different problems need different solutions. A one-size-fits-all approach doesn't work when it comes to policy making. Okay, that's all I have for today. Leave your thoughts in the comments, subscribe, hit the like button, and I will see you next time.